So, welcome today, and thank you for doing this interview for the Disability Rights Louisiana series on getting voters with disabilities more equipped with the candidates they'll have at the polls this election season. So, before we get started with questions that I sent you, can you take a moment to introduce yourself and the district you're running for?
Yes, I would love to. My name is Alex Mossing. I'm running for City Council District A. I am a native New Orleanian and a lifelong resident of District A. I went to school there. I currently live in Mid-City with my husband and our daughters. And I've been teaching in public schools in New Orleans for 15 years. I teach social studies, and a big part of my job is teaching kids how the government is supposed to work. And a lot of the times I just find that it doesn't work that way. And that's become a problem for a lot of the residents of New Orleans. I'm especially concerned about how many people have chosen to leave our city in the last few years, and especially because a lot of these people are my close friends and family members. And that's kind of why I got into this race. I know how government, what the services that government is supposed to provide, and the way that they are supposed to provide them equitably for everyone. And I would love to be a part of addressing some of where I see the gaps are in what actually happens and what's supposed to happen. So that's me.
Well, thank you so much for teaching our youth because that is a great profession and something we need a lot more of. So, for my first question that I'd like to ask you, um, what steps would you take to make New Orleans infrastructure and public spaces more accessible to all residents? And how would you ensure that residents with disabilities are at the table when decisions are being made about the city's built environment?
So I think something that a lot of people don't know about me, because I have been a teacher for the last 15 years, is that my career actually started in government. So I was a government relations director for the Home Builders Association of Greater New Orleans. So I actually have a background in city planning more than anything else. I spent a lot of time at the table right after Hurricane Katrina, especially helping to develop our current CZO, the Comprehensive Zoning Ordinance, as it's written, and then also talking about a master plan. And one thing that I've noticed as, like as the years have gone on, and I, like I've sort of lost track of what was going on with all that stuff and come back to it in this race, is I haven't heard anybody talk about our city master plan in years. And an important first step in making sure that we are actually creating accessible infrastructure is having a plan that lays out where that's going to be and what it's going to look like. So for me, a huge priority is we've done a lot of capital projects in the last 20 years. Do we have a record of where we currently have things like accessible sidewalks, ADA, compliant sidewalks, ADA compliant streetcar stops, right? I know we have far fewer of those than we should. And my big question at this point, and the thing that I would like to address if I am elected, is what's the plan? What does the plan look like? What is our current tracking system? Do we have a map that we could share with the whole community showing these are your sidewalks that are accessible, these are sidewalks that have not yet been prepared, and then taking it a step further and saying, if this is a sidewalk that isn't prepared yet, then it is on this is the schedule for when it will be prepared. We need to get back to that idea of a master plan. And in terms of who should be at the table when we are having those discussions to revisit what a master plan looks like and creating a multi-year plan for how we're going to fix the infrastructure that is not currently compliant, we should absolutely have disability advocates at the table to make sure that we have the right kind of infrastructure and not just sort of like the most basic services.
Thank you. How would your administration support economic opportunity for residents with disabilities? And what steps would you take to ensure that jobs across the city are truly inclusive and equitable?
Yeah, again, I'm a teacher, so this one is really close to my heart because I really believe that workforce development starts at school. And school is an especially great place for us to start including our kids with disabilities, including our citizens with disabilities of any kind, and really thinking about what inclusivity looks like, not just at school, but then beyond. So for me, I'm always talking with all of my eighth graders, regardless of their ability, about next steps, right? So they're going from me to high school. What does high school planning look like? What opportunities are there in high school for them to think about their college plans, their career plans? So I think what we should do as a city is we should be investing in programs that connect kids early on to what workforce development opportunities. We've got some programs like that I can give examples of. So the New Orleans Public Schools also already has what's called the Success Hub. And that's basically a program by which kids who are already enrolled in high school can be sort of dual enrolled, not in college courses, which is the more traditional way that we think about dual enrollment, but in a certification program of some kind to get an industry credential. So maybe it's a software credential, or maybe it's like it is a welding or like an apprenticeship sort of type of credential. But no matter what, we have that core program already. The city council should be supporting that program with funding and resources, and in building connections to. We have a workforce development office at the city hall. Our workforce development office should be closely collaborating with programs like the Success Hub to make sure that the services and the development programs that schools are providing are lining up with the needs that our workforce development office is seeing for the community. So that's a first step, is making sure that those types of programs are extended to all kids, no matter, regardless of their abilities. And then also that we are making sure that those dots are connecting, that like what the city is doing for workforce development is connected to what schools are doing with workforce development. I also, early in my career, worked with a program called the Louisiana Green Corps, which is specifically a workforce development program for individuals with intellectual disabilities. And I learned so much from working with that organization about just the scale of how people can be incorporated into different fields. Mostly we were focused on green job skills, so sustainable industries, which is important for our community since we're deeply affected by climate change. But I think talking to organizations like Louisiana Green Corps and thinking about what pathways they'd like to see for the people who are enrolled in their program going forward, like those are great first steps to think about. And then we should incentivize businesses to have inclusive hiring practices, because that's one of the best ways to make sure that we're really bringing people in and encouraging businesses to do the same.
I appreciate all your ideas and love them.
Thanks.
What is your vision for ensuring that residents with disabilities can access safe, affordable, and accessible housing across the city? And how would you address both affordability and physical accessibility in your housing policies?
Affordable housing is, again, like at the core of the reason I'm doing this. My brother just bought a house in Gulfport, Mississippi, even though he's a captain in the New Orleans Fire Department, because he can't afford to live in the city where he's a first responder. And I think this issue is just expanded because there are fewer workforce opportunities for people with disabilities. So affordable housing is especially important, I realize, for this community. First of all, we have this affordable housing fund that was approved by the voters last year. We have 5% of our budget that is allocated specifically to housing initiatives. And what the city council needs to do next is lay out a plan for how those funds are going to be allocated. So if I am elected to the city council, I will prioritize making sure that we have some of this funding allocated specifically for people with intellectual disabilities. And this can look a few different ways. Like this can just be sort of like basic subsidy support, which I think is important. But this can also be a fund that we can use to make some of these accessibility changes. So creating space for homeowners to retrofit their homes to make them more accessible, for landlords to retrofit homes to make them more accessible, and to help lower utility costs, right? Like if we can provide homeowners with the resources to do minor upgrades to their homes to improve energy efficiency, that will help them lower their costs. And that's contributing to affordable housing. If people can get fortified roofs put on their houses and have some of that expense taken from them by us contributing to that fund, then that will help people lower their insurance costs. That's going to attribute to affordable housing. So I want us to be really intentional about the way that we're allocating that 5% of the budget. And we want to prioritize the people with the highest need. So that includes people with disabilities, that includes our lower income residents. I think those are sort of details that we need to iron out. And that's something that I'll be really focused on, and making sure that those funds are distributed equitably in a way that is helpful to our community members most in need of those resources. And then in terms of design, again, back to the comprehensive zoning ordinance, we've got a couple of overlays right now where we are encouraging developers theoretically to create more affordable housing units. I think that we can add to those requirements, like not just should newly developed units be affordable, but they also need to be compliant with our standard like ADA sort of universal accommodations expectations. And we need to make sure that we are actually enforcing those regulations, because right now we have some rules attached to new development, but we don't have the enforcement at City Hall. The enforcement department is just empty. There's nobody there to go and actually check and make sure developers are compliant. And that is really important to me, making sure that we are enforcing that anybody who is getting subsidies to provide affordable housing is actually doing the things that they are required to do according to the subsidy.
Great. How will you work to expand access to mental health care in the city? And what role do you see the city playing in preventing incarceration of people with mental health conditions?
I was really fortunate to recently spend a day with the team at Odyssey House, Louisiana, and I think that organization is a model for how we can approach wraparound services for anybody who's experiencing a mental illness or a mental challenge of any kind. So Odyssey House is right now our contractor running our low barrier homeless shelter. And they also have in-house addiction and mental health support services for anybody who is experiencing homelessness. And I think their funding is really strategic because it's largely Medicare based, which is great. So this is going to this means that or Medicaid based, excuse me. So that's great, because that means that we as a city don't even have to put up a lot of the resources, and we're benefiting from this incredible service that they're providing. So when we have a provider like that can sort of help us create a model for what mental health services can look like, we should be supporting those organizations, and we should be asking for their expertise in any other programs that we build out. I know over the last year, City Council has worked really hard to fund more services in the vein of Odyssey House's vein. And they are working to really actively provide more mobile crisis unit operators. I firmly support that. We should continue that work. That's really important. Odyssey House did tell me that City Council last year approved work at what they have, the Sobering Center, and they're considering pulling back funding for that. But the Sobering Center, the budget for that center is about $1 million. And it saves about $8 million in incarcerating people who do not need to be incarcerated. So I think we need to be thinking big picture about funds where we're actually the way that we're preemptively preventing problems. And I think that goes to this idea of keeping people with mental health issues out of prison where they do not belong and are not being helped. So I think really thinking creatively about the community partners that we have and how we can expand those kinds of services through our own funding and sort of matched federal funds to create space for our mental health, people experiencing mental health issues, to find support instead of being incarcerated. No one else needs to be added to the Orleans Justice Center right now. Clearly, that place is not under control. We should be trying to keep everyone out of the Orleans Justice Center, especially people who are not actually criminals.
Exactly. And then my last question, how would you advocate for more equitable access to Medicaid and other healthcare support for New Orleanians with disabilities? And what types of policies would you support or oppose?
So this act, it's funny. My husband has worked for the Department of Veterans Affairs for his whole career, and he works in disability benefits. So I have a weirdly specific and like accurate view of how the federal government decides to award or not award disability benefits. And I also, because of that, know how complicated that process is. And for me, it would be an incredible community service if we could create some community support centers throughout the city, maybe even just at public libraries on a rolling basis. Once a month, there is someone who interfaces with the federal government and these services programs to just talk to residents about how to apply and where their application might be, and to support them in filling out whatever details they need filled out. Because, on the one hand, you can hire an attorney to help with that, but that's so expensive. And that's not that's not something that every person is able to do. So just because I know how complex those systems are, I think it would be I think I would be very much in support of providing that service to our community members. So that's like a first sort of piece of this. But beyond that, I am deeply concerned about the state of Louisiana and the federal government and their sort of actions in the realm of Medicaid funding and who is going to be, allowed to access these resources going forward and what's going to be cut. And so I think what we can do as council members, we are a legislating body, but we can also collaborate really closely with our legislative members from New Orleans at the state level, and then also with our Congress people. So, Troy Carter is representative of most of the city of New Orleans, but Steve Scalise is also a representative of New Orleans. And we should definitely be leaning on our local delegation, especially people who are members of the ruling party, to advocate for adequate funding for our residents. And I think those are the avenues that I would follow first, would be to really make sure that we have a strong relationship with the people best equipped to make asks on behalf of our citizens.
That's a great plan. So before we conclude today, is there anything else that you think we didn't cover or that you would like to add?
I don't think so. I think I'm interested in a New Orleans that works for everybody. And again, as a teacher, I spend a lot of time thinking carefully about how to make sure my classroom is an inclusive place for our students with disabilities. And I see firsthand how important it is to have infrastructure that allows for those kids to participate in activities with everybody else. And there's no reason that those same expectations for inclusiveness shouldn't extend to adults, right? Like from childhood through adulthood, we should all care about members of the community of people with disabilities. And I don't understand how we can be so serious about those inclusive measures in schools and then just let them go once people reach adulthood. So I would really like to see our city do better with this. And I think because I have this experience as a teacher working with kids, and I understand how eminently possible it is, right? Like we do this work every day in schools. There's no reason we can't do it every day in the city. So those are my thoughts.
Thank you so much, and I'll definitely be in touch.
Great.
And best of luck in the race.
Thank you so much. It was very nice to talk to you today.
Have a great day.
Okay, thanks. You too.
Bye-bye.
Bye-bye.